Diabetes, a common disease with serious consequences. It sneaks up quietly and sometimes hits hard out of nowhere. What can you do about it? There's a simple blood test that can give you certainty. And it's not the blood sugar. So stay tuned and find out which test is the most important one in diabetes diagnostics. Diabetes mellitus is one of the most common chronic diseases and often goes undetected for years. But a timely diagnosis can prevent serious complications and significantly improve treatment options. But how do you actually confirm diabetes? Which tests are really meaningful? And when should you get them done? Today we will go step by step through the most important diagnostic procedures, explain which values really count, what the latest medical guidelines say, and why a single blood sugar value is not enough. We also work out the strengths and weaknesses of each test. So, stick around until the end, and let's get started. I know that the topic of diagnostics is not the most fascinating or entertaining topic in the field of diabetes, but knowledge of the possible tests is also very important for those affected in order to know whether diabetes mellitus is already present or whether it may be at risk in the next few years. I will also reveal the diagnostic algorithm for diabetes mellitus at the end of the video. So, make sure to watch the video all the way to the end.
Welcome to Endovision with Dr. Berger, your leading channel for insightful perspectives in the world of endocrinology. Here, we highlight the central challenges of our time: diabetes mellitus, obesity, thyroid disorders, and the essential role of nutrition for a healthy life. Subscribe to Endovision if you are ready to take your health to the next level. Here begins the path to a healthier, self-determined life.
As expected, the first test we need to discuss is the fasting blood sugar, the classic in diabetes diagnostics. Fasting blood sugar is one of the most commonly used tests for diagnosing diabetes mellitus. You would think that with a fasting glucose, you can surely determine diabetes. Is that the case or not? What exactly does it indicate? How is it measured correctly? And what pitfalls are there? Fasting blood sugar indicates the glucose concentration in the blood after a person has not eaten for at least 8 hours. It concerns the body's ability to regulate blood sugar levels without the immediate intake of food. An elevated value can indicate that the body is no longer producing enough insulin or that the cells are not responding properly to insulin. The measurement is taken in the morning after at least 8, ideally 10 hours, fasting from food. During this time, only water may be consumed. Coffee, tea, or even sweet drinks can distort the result. The blood sample is taken venously from the arm vein, as venous blood provides more accurate and standardized values than measurements from the fingertip. The normal values for fasting blood sugar are below 100 milligrams per deciliter, equivalent to 5.6 mol per liter. In cases of impaired fasting glucose, prediabetes, the values range between 100 to 125 milligrams per deciliter, equivalent to 5.6 to 6.9 mol per liter. Diabetes mellitus begins at greater than or equal to 126 milligrams per deciliter, equivalent to greater than or equal to 7.0 mol per liter, in at least 2 independent measurements. A single elevation in blood sugar is not sufficient for the diagnosis of diabetes mellitus. It must be confirmed by at least a second measurement on another day. Medications such as cortisone, beta blockers, or diuretics can also affect blood sugar. Infections, surgeries, or acute stress can lead to temporarily elevated blood sugar. Despite its widespread use, fasting blood sugar has some weaknesses. Depending on the time of day, sleep quality, or hormonal balance, the value can vary. Blood sugar can remain in the borderline range for years before crossing the threshold, and yet, diabetes is already present. Fasting blood sugar is a simple and widely used test that can help diagnose diabetes. However, one should not rely on it alone. Therefore, next we will look at a functional test that can provide us with more information about glucose metabolism, the oral glucose tolerance test, oGTT. The oral glucose tolerance test, abbreviated as oGTT, is one of the most important tests for diagnosing diabetes mellitus and prediabetes. It is also referred to as a stress test for the pancreas. It not only shows the fasting blood sugar, but also how the body handles a targeted sugar load. This allows for the detection of early disturbances in glucose metabolism that fasting blood sugar alone often overlooks. But how is the test conducted? Which values are crucial, and what are the potential sources of error? Let's take a closer look at that now. The oGTT provides insight into how quickly and effectively the body responds to a defined glucose load. This involves 2 central mechanisms. Can the body release enough insulin to lower blood sugar? And how well do muscle, liver, and fat cells respond to insulin? An impaired oGTT indicates that glucose is transported from the blood into the cells more slowly than normal. This suggests significant insulin insensitivity, insulin resistance, or impaired insulin production. How is the oGTT conducted? At least 8 hours of fasting beforehand, no food, only water allowed. The diet in the 3 days before the test should be normal, and a low-carb diet, as this can skew the test results. No unusual physical activity on the day before the test procedure. First, the blood sugar is determined in the fasting state. Second, glucose load. After that, the test subject drinks a solution with 75 grams of pure glucose, dissolved in 250 to 300 milliliters of water. This must be consumed within 5 minutes. Third, after exactly 120 minutes, blood is drawn again and the blood sugar level is determined. The threshold values for the result can be seen in the display table. Diabetes mellitus is present if the blood sugar does not fall below 200 milligrams per deciliter, equivalent to 11.1 millimoles per liter. It is important to mention that values already in the prediabetes range are a warning signal for an increased risk of developing diabetes in the coming years, and urgent action is needed here. But there are also sources of error and pitfalls with the oGTT. A low-carbohydrate diet can distort the insulin response, as muscles and liver absorb sugar like a sponge without insulin. This would lead to a false negative result. Infections or stress can drive the values up, resulting in false positive outcomes. In patients with gastric emptying disorders, for example after surgeries, the test can be faulty due to absorption issues. Strengths and weaknesses of the oGTT. Positive aspects of the oGTT include the detection of diabetes. Diabetes mellitus can be identified even with normal fasting blood sugar. Many people with impaired glucose tolerance have a normal fasting level. Important test for gestational diabetes. The oGTT is the gold standard for diagnosing gestational diabetes. Early indication of insulin resistance. The oGTT indicates whether metabolic disorders are already developing. Negatively, it is considered labor-intensive, requiring time and patience, must always be conducted under standardized conditions. Planning is required. The sugar solution can cause nausea, which sometimes can even lead to vomiting. The oGTT is the best functional test to detect early disturbances in sugar metabolism even before diabetes becomes manifest. It is indispensable, especially for risk groups such as those with overweight, family history, or during pregnancy. Is there an even better and simpler test to diagnose diabetes? The next section is about another essential test, the HbA1c value, the long-term blood sugar. Could this possibly be the holy grail? The HbA1c value, also known as long-term blood sugar, is a crucial parameter in diabetes diagnostics. It provides information about the average blood sugar concentration over the past 8 to 12 weeks. But how exactly does this test work? Which values are relevant and what are its limitations? You'll find out now. What exactly does the HbA1c measure? HbA1c stands for glycated hemoglobin. Hemoglobin is the red pigment in erythrocytes, or red blood cells. The glucose from the blood binds relentlessly and permanently to the hemoglobin. So, it can be said that the higher the blood sugar level, the more HbA1c is produced. Since red blood cells have an average lifespan of 120 days, the HbA1c value reflects the blood sugar level of the past 2 to 3 months. This means that the HbA1c value serves as a kind of blood sugar diary, without the patient having to measure daily. How is the HbA1c measured? It is a venous or capillary. Blood sampling is necessary. No fasting phase is required. This test can be done at any time of the day. The analysis is conducted in the lab using highly precise measurement methods like HPLC. High-performance liquid chromatography. There are also point-of-care systems that can reliably determine the HbA1c value in a few minutes in the doctor's office. The result is given in percent or millimoles per mole. Percentage indication has so far been more established in practice and research. The standard values can be seen in a display table. Since the HbA1c can be determined at any time of the day, it is probably the most important parameter for the quick and, above all, reliable diagnosis of diabetes mellitus. An HbA1c value below 5.7% is considered normal. Between 5.7% and 6.4% is the so-called prediabetes, increased diabetes risk, and with a value greater than or equal to 6.5%, diabetes mellitus is present. In diabetes therapy, the HbA1c is also used for monitoring progress, and an individual target value for the HbA1c is set for each diabetic. Strengths and weaknesses of HbA1c advantages. No fasting measurement needed. Can be conducted flexibly, provides a long-term picture of glucose metabolism, less dependent on daily fluctuations and diet compared to fasting blood sugar or oGTT. Well suited for therapy monitoring in diabetes patients. Disadvantages: detects very early metabolic disorders less effectively than the oGTT. Distortion in certain conditions. Anemia can falsely lower the value, while iron deficiency or kidney insufficiency can falsely increase it. Therefore, determining kidney values and the blood count is important with each HbA1c measurement. In cases of doubt, determining iron and vitamin B12 folate metabolism is also necessary. Short-term blood sugar spikes, for example after an infection, often go unnoticed. The HbA1c is an extremely strong marker, but not infallible. It should always be considered in the overall context. The HbA1c value is probably the most valuable diagnostic tool for detecting diabetes and prediabetes and for monitoring therapy in the long term. However, it also has weaknesses, especially in early metabolic disorders or specific diseases. Next, we come to more specific blood values that play a role in the risk assessment for diabetes mellitus. Here, the HOMA Index and fasting insulin levels are the first to be mentioned. Diabetes mellitus often does not begin with elevated blood sugar, but long before with insulin resistance. But how can you recognize this in time? This is exactly where the HOMA Index and fasting insulin come into play. These tests provide us with important clues as to whether the body's cells are still responding properly to insulin or if there's already a disturbance in sugar metabolism. Let's take a look at that now. While fasting blood sugar indicates how much sugar is in the blood, the fasting insulin level provides information about how much insulin the body produces at rest. With the help of this value, insulin resistance can be estimated. In the case of insulin resistance, the body needs more insulin to bring blood sugar into the normal range and keep it there. In the early stages of type 2 diabetes, insulin is often high because the body is counteracting. So, compared to a non-insulin resistant person, a multiple amount of insulin is needed to keep the glucose level constant. In advanced or manifest diabetes, the value can become low because the pancreas is exhausted and can no longer produce enough insulin. An even more accurate estimation of insulin resistance involves considering fasting glucose. HOMA Index. The HOMA Index, homeostasis model assessment, is a calculation formula. It represents the relationship between fasting blood sugar and fasting insulin. It helps to detect insulin resistance very early and is calculated by many laboratories upon request. A HOMA index of less than 1.5 is considered normal. These people have normal insulin sensitivity. A slight insulin resistance corresponds to a HOMA index of 1.5 to 2.9. Values from 3.0 and above are considered clearly pathological and indicate reduced insulin effectiveness, an early sign of type 2 diabetes or metabolic syndrome. The HOMA index is particularly useful for at-risk patients who have normal fasting blood sugar but already have a family history, are overweight, or have metabolic syndrome. Since insulin levels fluctuate from day to day, this test is subject to high variability, making it rather difficult to compare values with each other. The fasting insulin level and the HOMA index are valuable tools for the early detection of insulin resistance, one of the main causes of type 2 diabetes. They are particularly helpful for people with overweight, a family risk of diabetes, polycystic ovary syndrome, PCOS, or metabolic syndrome. However, they should not be used alone for diagnosis, but always combined with other parameters such as blood sugar levels and HbA1c. The C-peptide level is used to check one's own insulin production. Diabetes is not the same as diabetes, and this is exactly where the C-peptide test comes into play. It shows us how much insulin the body is actually still producing on its own. This is particularly important to distinguish type 1 diabetes from type 2 diabetes, as we need to assess how well the pancreas is still functioning. C-peptide is a byproduct of insulin production. Insulin is produced in the pancreas as proinsulin. Before the active insulin is released, it is split into insulin and C-peptide. Since C-peptide and insulin are produced in equal amounts, it can be used as an indirect marker for the body's own insulin production. Why is knowledge about the body's own insulin production so important? In type 1 diabetes, insulin production is greatly reduced or completely absent, so the C-peptide is low or not detectable at all. In type 2 diabetes, the pancreas can still produce insulin, often even relatively a lot. Thus, the C-peptide is normal or even elevated. A high C-peptide level can indicate insulin resistance, as the body needs to produce more insulin to lower blood sugar. However, in advanced type 2 diabetes, the pancreas is exhausted and thus produces little C-peptide. The table shows the normal C-peptide levels and those for different conditions. When is the C-peptide test useful? Differentiation between type 1 and type 2 diabetes, checking insulin production before insulin therapy, detecting pancreatic exhaustion in long-term type 2 diabetes, distinguishing between insulinoma, benign pancreatic tumor, and external insulin administration. There are also typical sources of error and limitations with the C-peptide. Kidney insufficiency can distort C-peptide values. because C-peptide is excreted through the kidneys. Thus, C-peptide levels are falsely elevated in kidney insufficiency. Medications, such as sulfonylureas, can affect C-peptide levels because they stimulate insulin secretion. In insulin therapy, the test is not useful because exogenously administered insulin can suppress C-peptide levels. The C-peptide test is a valuable tool for assessing the body's own insulin production. It is particularly helpful in distinguishing between type 1 and type 2 diabetes, assessing pancreatic function, and in cases of unclear hypoglycemia. However, it should always be interpreted alongside other parameters such as HbA1c, fasting blood sugar, and HOMA Index. As promised, we now come to the diagnostic algorithm for diabetes. This diagnostic approach is recommended by the American Diabetes Association and the European Association for the Study of Diabetes, and it has been well established for a few years now. In advance, we discussed all the tests and diagnostic possibilities. These are now all thrown into a pot, shaken, and then pulled out of the magic hat in a meaningful order. First, we have as an entry point the symptoms of diabetes mellitus as a justified indication for diagnostics. These include polyuria, polydipsia, weight loss, or a risk constellation such as massive insulin resistance or a history of gestational diabetes. The first blood test that follows is the determination of HbA1c. This can be determined very spontaneously without planning and preparation and provides a very good initial assessment. For all individuals with an HbA1c under 5.7%, diabetes mellitus is almost ruled out. With a value of 6.5% or higher, diabetes mellitus is confirmed. Now, the HbA1c gray area from 5.7 to 6.5% remains. Here, we need to use other testing methods to determine clearly whether diabetes mellitus is already present. Here, I prefer the oGTT right away, as it includes both fasting blood sugar and the stress test of the pancreas. With this, diabetes mellitus can then be confirmed or ruled out. With a fasting glucose level of 100 to 125 mg per deciliter, equivalent to 5.6 to 6.9 millimoles per liter, and or a 2-hour oGTT level of 140 to 199 milligrams per deciliter, equivalent to 7.8 to 11.0 millimoles per liter, diabetes mellitus is not present, but there is a very high risk of developing it in the coming years. Although medication therapy is not yet approved here, therapeutic general measures such as lifestyle intervention, diet, and exercise should be established. Diabetes is a complex disease, and an accurate diagnosis is key to proper and, above all, timely treatment. However, no single test can capture everything, whether it's HbA1c, fasting blood sugar, or oGTT. Each of these tests has its significance in uncovering this insidious disease. To unmask diabetes mellitus, various parameters are combined to obtain a complete picture. HOMA, C-peptide, and insulin levels help determine the risk of developing diabetes mellitus or to initiate the correct form of therapy. Diabetes often develops unnoticed over the years. Those who know their values can take countermeasures early. If you have risk factors like being overweight, high blood pressure, or a family history, then talk to your doctor about the right diagnostics for you. Diabetes during pregnancy or the endocrine disorder PCOS, polycystic ovary syndrome, are also important risk factors for diabetes. Here too, you should talk to your doctor about the right diagnostics. If you liked the video, give us a thumbs up, give a like, and subscribe to the channel. Share the video with friends or family and activate the bell to not miss any more medical explanation videos. Do you have questions, suggestions, or your own experiences with diabetes diagnostics? Write it in the comments. Stay healthy until the next video.